Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool, here to give you an update on the coronavirus pandemic and how it's affecting Blackpool. Happy New Year to you all. I hope you had a great Christmas and a peaceful New Year. Just to give you an indication of where we are, our case rates are very high at the moment, as they are across the country. Cases have risen sharply over the latter half of December and then into January. And this is locally and nationally, we're seeing this craze. Omicron is very transmissible and we're seeing lots of transmission. So currently we're seeing about 500 cases every day in terms of the numbers coming through. Now, previously in the last few weeks before Omicron hit, I was seeing 60, 70 cases a day. Now it's gone up to 500. So it just gives you an indication of how much more transmissible this is. So that's why key thing is we need to continue with the Plan B measures. Get vaccinated. Get your booster dose. If you haven't had first or second doses, please come forward for that. Wear a face covering in most indoor places and on public transport. Work from home if you can. Let fresh air in if you're going to meet with others indoors. Outdoors is, of course, safer. And, of course, getting tested and self-isolating if required. So please continue to follow all of those Plan B measures. Just focusing in on vaccinations, walk-in vaccinations and booked appointments are readily available here in Blackpool for everyone aged over the age of 12. You can see the latest eligibility and details about where you can get first, second or booster COVID-19 vaccine doses locally in the useful links section to this video. So please go to that and have a look. If you've already had your first 2 jabs and are eligible for your booster jab, please go and get your booster jab. It's really important because 3 doses are required to protect ourselves from Omicron. If you haven't had the vaccine at all, please visit one of our sites and get vaccinated. It's never too late to have your first or second dose. If you're nervous or you just want to chat with someone, please pop down to one of our vaccine sites or to the vaccine bus. Someone will one of our friendly staff will have a chat with you. There'll be no pressure, no judgment. Testing 1 in 3 people who catch COVID will not show any symptoms. That's why it's really important we keep testing to protect ourselves, the people we love and our communities. The self-isolation advice for people with COVID-19 has changed. So it's now possible to end your self-isolation if you've been positive for COVID-19 after 7 days with 2 negative lateral flow tests taken 24 hours apart. The first lateral flow test should not be taken before the 6th day, so that's an important change. As a temporary measure in England, if you get a positive lateral flow test, then you'll no longer need to take a follow-up PCR test. You should self-isolate immediately. We've linked the opening times of how and where to get lateral flow test kits locally, and you can read more information about that, about testing in the useful links section. So self-isolation, if you're fully vaccinated and live in the same household with someone with COVID-19, the rules for self-isolation have changed. You're not legally required to self-isolate and can instead take a lateral flow device test every day for 7 days. You must self-isolate if any of these test results is positive. If you're not vaccinated, unfortunately, you must self-isolate for the full period. And you can get full details of everything I've said in the links below. NHS COVID passes. Certain venues and events will be required by law to check that all visitors aged 18 or over are fully vaccinated, have proof of a negative test in the last 48 hours or have an exemption. So remember to have that ready for those venues. Travel, if you're leaving or entering the UK, please look at the latest information about vaccine status, passenger locator forms and more via the government website, which again is linked below with this video. And finally, a quick thank you to all our residents and local businesses for keeping up with and following the rules and guidance. This is greatly appreciated. It's really important for us to follow all of this to keep our communities safe. Remember, mask wearing where needed, hand washing, regular symptom-free testing, self-isolation, etc. And whilst we're doing so great at supporting each other in the local community. Let's be mindful about using our NHS services in the most appropriate way. And A&E pressures have been at a peak level for some time, and we really need those services to be reserved for those critically serious and life-threatening emergencies. There's a great deal of support available for those who need urgent care but don't need to visit the emergency department, such as 111. The call handlers are very helpful and may even be able to sort out help and support via the phone or make appointments for you. So please, for those things that are not critically serious or life-threatening, please try and use alternatives such as the 111 service, which can be accessed via telephone or online. Thank you very much for listening. Goodbye to you all. See you on the next one, and please stay safe.